Hello everybody, welcome to the Thursday edition of Video Clips, and just a quick announcement, fall semester, I cannot believe we're already talking about fall right now, but fall semester starts in 8 weeks at the Wellness Forum Institute. So if you're interested in taking classes, I'm teaching a new one on nutrition and obesity, which I'm very excited about. I just started doing research for putting the curriculum together, and so I'm teaching that. We're having microbiology too, nutrition and cancer, lots of great courses. So if you're interested, let us know. We'll send you some information. So I have two topics I want to cover today, and both of them I've talked about before, but I'm going to keep talking about them until everybody tells me they've stopped using these things, all right? So the first one's birth control pills. According to Health Canada, 23 deaths and 600 adverse reactions have been reported as a result of taking Yaz and Yasmin birth control pills between 2007 and 2013. Now, something I want to point out, that doesn't mean that there were only 600 reactions. That means 600 reported reactions. And estimates vary, but a lot of people say that you can use about a 10-to-1 ratio for every person that is reported. There are 10 that aren't, so it's probably closer to 6,000. But anyway, I went to the websites for these drugs to look for side effects, and common side effects were nervous system, vascular, and respiratory disorders. Cardiac side effects were listed in 4.1% of the cases for Yasmin and 6.6% of the cases for Yaz. The labels on both drugs include warnings for higher risk of venous thromboembolism that is between 1.5 and 3 times higher than for other birth control pills, resulting from the synthetic progestin that's in these pills. The websites for both drugs state that taking the pills increases the risk of blood clots, stroke, and heart attacks. But they also say, in addition to get through reading all the risk factors, they say that the drugs are really useful for treating acne and premenstrual dysphoric syndrome, which is a fancy name for PMS, and that the drugs provide a daily dose of folic acid supplementation, which is recommended for women in their reproductive years. Now, I have to tell you, taking pharmaceutical drugs that have all these side effects that I just talked about to get folic acid supplementation is a ludicrous idea. If you're eating a Wellness Forum style diet, you get many times the daily value or required recommended daily allowance for folic acid because of all the green leafy vegetables you're eating. And the other thing is using birth control pills to treat acne and PMS, equally ludicrous. Diet takes care of both of those things too, which leaves birth control as the only justifiable reason for taking these pills. Now, I will acknowledge that in certain third world and developing countries, because of the attitudes that men have about women, this may be a viable option. But for women in westernized countries, I have to believe that if most of them knew the potential side effects of these pills, they would opt for alternative methods of birth control. Now, I wish I could tell you that things are different in Canada than they are here, but they aren't. Health authorities in Canada have been quick to reassure women that there's no reason to overreact and stop taking the pills, and the Society of Obstetricians and Gynecologists reports that the pills are safe and effective. Bayer, the maker of the drugs, reaffirms that the drugs are safe. And so it looks like they handle things in Canada the same way that they handle them here. It's much more about protecting drug companies than it is protecting public health. So if you are still taking birth control pills watching this video clip, stop that. All right, now let's talk about fish oil again. Why? Because every day it comes up. I don't think I go a week without getting 5 or 10 emails about fish oil. It comes up when I'm talking to members and that sort of thing. But a new study, still another one, shows that fish oil supplements don't reduce the risk of cardiovascular disease for patients with risk factors. The study included 12,513 patients who were randomized to either get fish oil or placebo, and after 5 years of follow-up, there was just no difference in the groups. 11.7% of the patients who took fish oil died from CVD, and 11.9% taking the placebo died of CVD. And here's what the researchers said. Our findings provide no evidence for the usefulness of omega-3 fatty acids for preventing cardiovascular death or disease in this population. And this held true for everybody. If their intake with omega-3 was low when they entered the study, they did or didn't take aspirin, they were or were not on statin drugs, it just didn't matter. Now, in spite of that, everybody responds by saying there's a lot of confusion about this issue, about the benefits of omega-3 fatty acids. And there isn't any confusion if we are clear about the end point, which is people not having events, living longer, not ending up with progressive coronary artery disease. Now, it's true that fish oil, for example, has been shown to raise HDL levels. The problem is that higher HDL levels do not translate to improved health outcomes or reduced incidence of cardiovascular events or death. Studies continue to show that it doesn't matter if you're manipulating biomarkers with drugs or supplements, unless you're changing the underlying health of the organism, meaning the human body, nothing is going to get better. But an entire industry has developed around this omega-3 issue. Fish oil pills, supplements, omega-3 fortified foods, books describing the benefits of omega-3. It's become a huge business with vested interests who are not likely to let go easily of the cash cow. And I find it really interesting that the natural and alternative community has become just as good at protecting their financial interests and protecting the use of useless products and incorrect ideas about health, which is the very thing they criticize the traditional medical profession and the drug and device makers for doing. It's true that money does tend to change things for a lot of people. So take it from me, I have nothing to gain financially from whether or not you take or don't take fish oil pills. Throw out the fish oil and omega-3 supplements and spend your money on good food. All right, well, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I will be back to you next week.